there's a lot of people right now who maybe don't have time to even get mental health support because they're so focused right now on just getting safety, finding housing, right? Um, what would be some things you would say from your research, interventions or things that they can do in the meantime while they're waiting before they get a chance to maybe talk to a clinician or a doctor?
Yes, so if you're in the acute phase, um, I would say some of the most important factors that I have observed in our data that protect the well-being of the individual include number one, physical activity, which means that please move around during the day as much as you can. Physical activity can be a great resilience booster for the brain. If it's not the right environment outside, there's still smoke in the air and you can't, move around outside or go for a run. Think about physical activity inside. Put on some music and dance to it. Dance can be extremely therapeutic. Um, and and beyond physical activity, the way we take care of our minds is through mindfulness. You talked about mindfulness a bit, and essentially, in these moments, it's important to understand that I am in a safe space at this moment. I am, the more I immerse myself in the present moment, I'm able to disengage from the threat and the trauma of the previous moment and not let it slip into my present self and my present moment or my future moment. So practicing skills of mindfulness and is very important at this point in time. It also helps us calm down. It helps our bodies calm down, and really, beyond mindfulness, we also see that individuals who have good family supports and social supports tend to bounce back faster. So please do not hesitate to reach out to your family and your friends. And this is not your task alone to rebuild. Reach out to people to help you in the rebuilding effort. People want to help you at this point of time. They are thinking about you. And if you can get good help from others, that will help you recover from the situation better. So I'd say those are important things, and try to, in general, try to maintain a daily routine as if there weren't a disaster. I know it's not possible or it can be very challenging, but the more you can try to model calmness and routine activity, the more your brains can get into a state of less hyper arousal, get to be in a more normalized state that, hey, I'm not under threat anymore. And again, this is all even more important when we have children in the house who are watching us and seeing how calmly we're responding to a situation such as this.
Have you seen anything as far as types of therapy models that have been successful, like cognitive behavioral therapy, dialectical behavioral therapy, or mindfulness? Have you seen anything like that as like what has been like most effective in helping folks?
Yeah, so the field of climate trauma is a new field in itself. So being able to define climate trauma, being able to say that this exists and our clinicians should pay attention to it and that it can be long lasting and to have awareness around that, it is in itself a huge step. Beyond that, when we think about mental health treatments, we're not trying to redesign the wheel. We're not saying let's figure out new treatments. Our treatments exist and they're all efficacious at their own level. There's no real comparator study right now that CBT, cognitive behavioral therapy, is better than other forms of therapy, or prescription medications are better than therapy. There's no real good evidence-based research around that. What we know is that there's going to be a huge population that's going to need help, and that we figure out how to provide those supports as best as we can. And while professional support is coming to people, if they're they're on a wait list to meet a psychiatrist, in that time, of course, practicing mindfulness skills, compassion skills, both for the self and for others in the community, being able to participate in relief efforts, and contribute to positive community building again. All of this can be very beneficial to mental health. That's been shown. But yet, currently, there hasn't been good research around if there's a specific kind of therapy that's most helpful in the aftermath of a climate disaster. What I would say, and what I think would be effective, is this collective healing would be effective more than individual healing. Being able to see how your own personal experience is part of sort of a common experience that many of your neighbors have undergone, that can itself help alleviate some of the anxiety. So I do feel that group therapies in this situation can be very effective. One thing I'd give a shout out to is work that I've done in the domain of ecotherapy. This is not something that's been studied or can make much sense in the acute phase, because ecotherapy is basically studying mindfulness in nature, and it's kind of like exposure therapy, where you are exposed to the situation that traumatized you, except that so when you go through a climate disaster, you're seeing the natural environment around you really just melt away in case of a wildfire and burn away. And so anything that triggers that experience becomes a negative, traumatic response in your brain. And your brains sort of need to then understand that, hey, actually, not every experience in nature is a negative experience. Nature can be very relaxing, it can be very healing, especially when you're back in a safe spot. So in chronic survivors who still suffer from mental health symptoms, but this is, months after a disaster, many places in California, but also outside of California, have started ecotherapeutic groups where individuals practice mindfulness in nature together and are able to relate to their climate trauma experience, as well as nourish themselves with the calmness of the nature that's around them. And that we find does have positive mental health benefits. We're looking at its long-term benefits. We definitely see immediate benefits of ecotherapy, but we're also looking into how long-lasting those benefits can be for an individual. So, climate trauma is within this sort of larger perspective of ecological destruction that's happening around us. And when we think about restoration of the environment, it's restoration and rebuilding that needs to happen of our homes, of our environment, and that includes our inner environment too. So it's all connected, right? The environment that's inside us is connected to the environment that's outside us. And so let's be good stewards of the outside environment, and that outside environment is a great healer. And so ecotherapy takes advantage of that. It leverages that ability of nature to just help us be calm. Of course, that comes at a time when you can access a space that's natural and calming. So that's not something we can do while we're still under fire threat within the community. And I really hope that the situation improves in LA and our surrounding areas soon. But yeah, those are the things that are happening in the field. But it's not that we need to reinvent the wheel. It's existing therapies can work. We just need good access to them.
Thank you so much for listening to this episode of the Delgado Podcast. As always, you can get the show notes, video links, and resources mentioned in this episode on my blog at mikedelgado.org. You can also get updates to new shows and get access to the full archive of past shows by following the Delgado Podcast on YouTube, Instagram, Twitter, and TikTok. And if you ever have suggestions for future topics or guests you want to hear from on this show, please reach out. My email is delgado at ucla.edu. Thank you so much for listening, and we'll chat more next time.